It's my pleasure to have Aaron Roome give us more of a local picture of what's happening with MSM here in Connecticut. Aaron.
Thank you and good morning. Whoops. Well, that's okay. To save time, I could just say ditto, and you can't go wrong with the national data, but I do want to provide a few numbers describing what's happening here in Connecticut. Now, and my assignment is to focus mainly on MSM trends over the past few years. But HIV/AIDS surveillance has been conducted in Connecticut since the early 80s, and almost 20,000 cases have been reported since then, with almost half of them having died. The importance here is that about 25% of cases that have been reported in Connecticut have been in MSM, about 2,700 cases. This breakdown, there's a couple here. One is by race, ethnicity, one by age group. You can see that by race, ethnicity, about 2/3 of cases are white, with about 20% black and 20% Hispanic. And then by age, about 3/4 of cases are over the age of 40. So this is primarily middle-aged group of people. And then very small percentages under the age of 20, and then somewhat larger percentages between 20 and 40. So predominantly HIV-positive MSM in Connecticut are white and above the age of 40, but not all race ethnicity groups have the same age structure, and that's shown in the next slide, and was covered by Ted as well. And you can see here there are two breakdowns, one among white and one non-white. The age structures in white, about 15% of cases are below the age of 40, but 40% of cases that are non-white are below the age of 40. And then conversely, you can see that many of the white cases are even above the age of 60, where very few of the non-white cases are. So these very different age structures could have implications for what sorts of prevention interventions might be expected to be effective in different groups. Now here, getting into the trends in MSM, there's two pie charts. One shows the bulk of cases diagnosed between 1981 and 2004. About 25%, as I said before, were MSM. But in more recently diagnosed cases, you can see that almost 1/3 or greater of cases have been in MSM. Now these are proportions of cases, so we need to take a look at the actual numbers to see what the trends are. And you can see here the top line is actually a decreasing trend in diagnosed cases among all people with HIV. Okay, and what I've shown here is the IDU, MSM, and heterosexual groups, which is the vast majority of cases. Now the individual trends are shown below there, and you can see the IDU cases are actually accounting for the majority of the decrease in cases, and they decreased from 400 cases to around 100 cases over this 8-year period. Heterosexual cases also decreased somewhat, from around 250 cases to around 100 cases. But you can see the MSM cases have not decreased. So they've remained stubbornly flat over this entire period. Now this trend shows the year of diagnosis among IDU, heterosexual, and MSM, and this is the proportion of cases. It's the same data as we showed in the previous slide, but you can see that because the IDU cases decreased, the proportion of cases that are MSM has actually increased. So the proportion of cases in 2009 was 46%. And that's approximately what it was, the proportion of cases that were IDU cases at the beginning of this time period. Now this is in a little more detail. This is strictly MSM cases over a period of 2006 to 2009. And the top line is the total MSM cases that have been diagnosed in Connecticut. And then these other lines are breakdowns by, the red line is white, and then black, Hispanic. And then at the bottom, there's actually been about 15 cases of Asians and others who have been diagnosed over this time period. And you can see that where there is a suggestion of a decrease among white MSM, I don't I don't think I'm ready to say that there actually is that decrease, because if you look earlier than this time period, you see cases, this is more like a fluctuation. And in fact, if you look at the Black and Hispanic total, those numbers of cases have actually remained flat over this time period. Now, this slide shows the net change in the people living with HIV in the various risk groups. And you can see over this period of time, the people that are living with HIV that are IDU hasn't changed. Okay? There's been very little change in the number of people in that group. Heterosexual has gone up by about 14% over this time period, but the number of people who are MSM has gone up almost by a fourth, or 23%. Now, the next couple of slides are maps of Connecticut, obviously, and what's shown here is a distribution of MSM cases by town of residence. And the white towns have no cases reported, and then the lighter green towns have 1 to 4. And you can see if I advance to MSM or to IDU and then go back, you'll see that the distribution will leap out at you a little bit, that there are, in fact, many, many towns with small numbers of MSM living in them distributed around Connecticut, whereas with IDU, there's actually half as many towns that have 1 to 4 cases of IDU living in those towns. Now, this is part of the national HIV incidence study that was mentioned previously, but this is the Connecticut data. And you can see that overall, as part of this study, 600 people were infected with, were estimated to be infected with HIV in 2006. And the largest proportion of those were actually in MSM at about 184. So significant numbers of MSM are continuing to be infected each year. Another thing that's come up recently is that the CDC has released a prevalence estimate of MSM in the population, saying that 4% of men above the age of 13 are MSM. And if we do some rough calculations, we find we can estimate that 55,000 people, men in Connecticut, are MSM. And we know of those, the ones we know of, 2,700 are infected. And in doing that, we can do an estimate that 5% of MSM are currently infected with HIV. And I have a bullet here that higher risk groups within the MSM would be expected to have much higher rates of infection, and that's certainly true, as it is for other demographic subgroups. People are not homogeneous within certain groups, and of course there are MSM that are also IDU, there are MSM with multiple sex partners, MSM with high-risk sexual behaviors, as you've heard. So, in conclusion, data from a variety of surveillance activities point to continued transmission of HIV and MSM, and these systems are both the Connecticut and the national HIV/AIDS surveillance systems, the HIV Incidence Project, STD surveillance, which you're going to hear about next, as well as matches and other interactions between the HIV and STD surveillance systems, which Heidi will describe. While a number of HIV/AIDS cases in IDU has decreased, the number of newly diagnosed MSM cases has been level over the past several years, and the number of people living with HIV/AIDS who are MSM has increased by about 25%. The percentage of non-white MSM HIV/AIDS cases has increased. Non-MSM cases tend to be younger. MSM cases are distributed broadly across the state in both rural and urban areas in significant numbers. And new estimates of MSM prevalence yield HIV rates in MSM for the first time. And these calculations show that HIV risk in MSM is comparable to other high-risk groups in Connecticut. Okay, thank you.